Welcome to the Quimby Chronicles Momcast, where we talk about all things motherhood, family, and keeping your sanity through it all. On today's episode, we're talking about Black maternal health. We're using our personal experiences to highlight the need for community awareness and action to address these disparities and ensure safe and equitable maternal care for all women. Ready to join the conversation? Come on in.
Hey guys, welcome back to another episode of the Quimby Chronicles Momcast, where you guys already know we keep it real and relatable. I'm Shantae, and I'm here with my mom Tracy today.
Hey y'all, hey Shantae. So today, in honor of Black Maternal Health Week, today we are going to talk about Black maternal health. So let me give you a little bit of insight on Black Maternal Health Week, and yes, I'm reading it from the website. Okay. So Black Maternal Health Week is a week-long campaign led by the Black Mamas Matter Alliance, which is focused on a lot of the things that we support here at the Quimby Chronicles. Okay. So now that gives a great segue into our next section, which is the power of advocacy. So a lot of people, well, we're human. So you don't know what you don't know. You know, if you don't know it, you just don't know it. And then a lot of times, if you don't know something, you have no idea what questions to ask. So advocacy is a very big important, not only for Black women as far as maternal health, but Black women in general. Advocacy is so very important. Having that knowledgeable person there, having that person there who's outside the situation that can see. So things that can help with the advocacy. Number one, when you're pregnant, come up with a birth plan. Now, I've seen birth I've seen birth plans. Okay. Um, some of them are very practical. They're very, they make sense. And some of them allow, and they allow for medical intervention if needed. Some of them are very restrictive and they're very detailed, like down to the letter. And a lot of times, especially in a hospital setting, that's not practical. There's a lot of things that hospitals, you know, I wouldn't say require, but hospitals want that can benefit you and your baby in the long run. And I know one thing that people complain a lot about was the fact that they had to have an IV, they had to keep an IV. The rationale behind that, which I get it, and I'm all for um patients' rights and patients deciding, what they want. But with the IV thing, I am 100% with it because you never know what can happen. Your blood pressure can shoot up. They can give you some blood pressure medicine IV and bring it back down. You can something, God forbid, something can happen. You could develop like postpartum heart issues. You got your IV, then boom, we give you some medicines. So I do agree with the having the IV until you discharge thing. A lot of people don't. But if you have a birth plan, use the birth plan as a starting point, a discussion point. I had a patient one time that she wanted to have like essential oils all around the room, the warmers and stuff like that. We're like, well, you can't do that. You can't plug them in because, the hospitals have rules as to, you have to have your stuff inspected before you can plug it in. We couldn't have the ones with the light, with the candle, because it's
No,
oxygen. You can't have a flame, it's like, oh, sorry, but I could give you some gauze and put some on it and kind of lay it around the room, put them in some medicine cups, you know what I mean? So a lot of it is improvisation, but if you have a birth plan, use it as a starting point. And, as much as you can, stick to it and talk with your providers, talk to your nurses, talk to your doctors, and discuss it with them. And if you're not able to, again, have that advocate do that for you. And Shantae was lucky enough to have nurses during her birth that advocated for her, and I'm so thankful for that because that was definitely like that crazy post COVID era where everything was nuts. Only at least, what was it, like two people were allowed in in the delivery room, but I think at one point there was only one other person that could spend the night, and it was just, very restricted. Um, another, yeah, another resource that you can use as far as advocacy is a doula. That's what doulas do. Doulas are your advocates. Doula. Okay, well, I was Shantae's doula for free, and I think she owed me some money. Okay, I was her doula, and okay.
No, because those are your grandchildren. That's your payment. You got to see and witness your come into this world. I feel like that's payment enough. That's payment for life. You got to witness both of your grandchildren coming into this world, and you got to coach me through bringing them into this world. I feel like that's payment enough. That was such a beautiful experience. You can't buy that experience anywhere. You know what I mean? Like those are your own grandchildren. You can't buy that type of love and experience.
Bill, I'll send an invoice.
An invoice is crazy.
Send an invoice.
She's not lying, guys. She really was like my free doula both times. Because one, with the first one she was coaching, the second one she was coaching and actually delivered my daughter. That was
You gotta have that. And I mean, at the least, it doesn't have to be somebody who's knowledgeable in healthcare or anything like that. At the very least, have someone that's gonna speak up for you on your behalf, who's gonna call you out. I know I had a patient one time that, I went in and I was like, "Hey, you having any pain?" And she'd be like, "Well, no." And then the husband was like, "Well, she just said that her lower back is killing her." Hmm. Okay. So let me check. Yeah, let me check you. So you need that. We may not always like it, but we need that. We need somebody in the healthcare system that's going to have our back above all else. Um, then the next thing is, you know, I feel like the way Black women are perceived, which some of it may be warranted, but the way Black women are perceived is that we're aggressive. If we ask questions, oh, you questioning my no, I just want I just want to know. So and it shouldn't be like that. We shouldn't have to get aggressive to get care. It should be that this is the standard and then we go and buy it. So it's like, come on, man. Come on. Okay? All right. We've been yapping for a while and we still only on the third part. Mhm.
the six.
Well, I mean, so you want to talk about postpartum depression? You want to talk about the mental health part?
For sure. Um, I feel like we just touched on the solutions and support where you're talking about the community health centers, midwives, Black OB, GYNs,
Uh-huh.
the solutions and support.
Uh-huh. What about yeah, so I can just get some stuff together for this area.
Okay.
Or I know that lady Tasha Rogers, she's a doctor, she's a Black OB in Atlanta. So she probably has a
Grandma told me about her like maybe like a couple months ago.
yeah.
Because she had sent me, I think, like a YouTube video or something like that. She was the one that told me about her, and I know when I went to follow her, I saw that you were already following her, and I was like, oh, okay, cool, cool, cool.
Okay, so what is this? Let's do mental health matters, generational silence, and then I could just say real quick that throughout the week we'll share um resources about we'll share resources for Black moms.
Okay, so I'm gonna cover all of the mental health, right? Or
Yeah, you body mental health. I'll do we could both do the generational science, silence, and shame. I'll do solutions and support, and then we could both do the end.
okay, got it. You good?
Hold on, let me tell him. He talking about we're on the way back because we've been yapping.
Oh yeah, and it's been a hot minute too.
This is only the first one.
Yeah, we could do the second one like sometime later this week if you want, or tomorrow, whatever day.
I'm going gallivanting, so it's gonna have to be like Monday, Tuesday.
We can do Tuesday because I didn't tell you, but I actually made a couple mom friends that live on base, and I'm gonna
Right.
meet them on Monday. So I don't know what time we're gonna be back. So I'll just say Tuesday to be safe
I like
because I
Tuesday.
go to Kohl's and we just wanted to like walk around stores and stuff.
Yeah.
He also likes window shopping. And I was like, oh yeah, I love walking around looking at stuff, girl. Sign me up. Because I made two mom friends. One has a daughter Luca's age, and one has a daughter Selena's age. So yeah, getting myself out there.
Good.
I was so proud of myself, and Danny was like, "You know what? Love that for you." And I was like, "Right," because I've been meaning to do this since we got here, and I'm just now doing it. So, and when you're
Great.
ready,
Hold on. Let me tap my boot back.
that's who you're going gallivanting with. That's who you're going gallivanting with.
Uh, Thomas Allen and his.
Uh-uh. Not the first time. Hmm. So not the first.
I told him I'll be right back. I said I'm gonna go do this podcast. So he talking about okay, talking about be great.
Be great.
And I said yeah, cause why not? Why is heart so big? Jeez. Uh-oh. Yep. Okay.
You
All
hear
right.
me?
Yeah.
Oh, okay. It was just talking about iPhone microphone connected, and I was making sure
Is
because
that you?
you remember last time.
Yeah. Yeah.
You remember last time it was messing up.
All right. So let's do it. Mental health matters.
Okay. Are we still tying in like personal stuff? Or
You can just a short personal something.
yeah, I'll just bring up my Britney Spears moment again. Because they did
I'll just
after
yeah, be like if y'all saw whatever, whatever, and then be like, yeah, we'll link the video here about your Britney Spears.
I don't even think I ever I don't even remember ever telling you they had like some sort of counselor come and talk to me before they discharged us with Luca based on my survey that I turned in. I was like, oh.
Yeah,
Because
yeah, because they always have you do a screen. Yeah,
I think they said it flags at like 5 out of 13 or something like that, and I was at an 8, and I was like, oh.
yeah.
Well, I was like, well, I don't think I'm gonna hurt myself or my baby if that accounts for anything. I don't I don't feel violent.
The thing is too, they don't. Well, let's start and then we can talk about it.
Okay.
You could talk about that part too. Be like, oh, if you go back and look at, I can't even remember what episode it is, and then I'll post it. I'll when I do the video, I'll put a link to that video.
Okay, so should I just mention if you saw our past video?
Anxiety,
I think so.
the anxiety video
Okay, so I'll say if you guys
episode about anxiety or
yeah.
mom. Yeah.
Okay,
If
got
if not, watch it at the link below. Mm-hmm.
do. It'll be right here in the description bar. Oh. Okay. I'm ready.
Okay.
Good. Okay, guys, now we are going to talk about how our mental health matters also. And you guys know I touched on this a little bit in our Dealing with Anxiety as Moms podcast video, which if you were not able to catch that, it will be linked below so you can go ahead and watch it. But I remember when I had to do, if you're a mom that's giving birth, in the hospital that they give you like before you're discharged, or really, I did it probably like as soon as I got into the recovery room, they gave me one of the surveys and, they have you, rate how you're feeling and, just answer the different questions on there. And I remember a nurse coming back to talk to me after about an hour after she came and collected mine. She was like, well, we're going to have someone come in here and talk to you before you're discharged because she's like, our system just automatically flags it if it hits at least a 5. And I had an 8. And it was like out of, I think, 13 different questions or something like that. So it was some sort of counselor. It was a specific counselor. I want to say like something to do with like postpartum counseling or something along those lines. It's like I said, that was almost 4 years ago. It's a little fuzzy. So
Right.
is I just know it was some sort of counselor that came and was talking to me, and, asking me how I felt, and I had to like run down the whole thing for them, like the whole labor process. They had me just pretty much talk about a bunch of different things. And they were like, well, we have like support groups if you feel like that's something you'd be interested in and things like that. And, asking me different questions and having me give answers to specific scenarios that they were asking before I was even able to be discharged. And obviously, I get why they do it because, things like that, when it comes to mental health and postpartum, things can sneak up on you. But personally, I feel like it didn't sneak up on me. I just kind of shoved it down instead of, finding a proper way to deal with it. So it kind of spiraled into like this little whirlwind situation where I was super irritable all the time. I didn't want to be bothered with anything. I wasn't motivated for anything. It just got really bad for my mental, which that's on me because I should have dealt with it a healthy way instead of just trying to shove it down, which I've always tended to do that. And I know once again, on me, I'm taking accountability. I'm awful about until like the past like year or so, I've been really awful about, being in touch with my feelings and how I feel and finding out things that I need to do to help me. So we're better now. It only took about 4 years. It only,
Bro, okay, we clocked it.
I made it there. Is as they say, better late than never. But mental health is really important. And I remember I saw a post actually, I think either earlier today or yesterday, where a mom posted because I'm in like some sort of mom group, like I'm in a boy mom one and a girl mom one because obviously I have a son and a daughter. But there was a post in it that said, "Man, I'm glad I lied on that survey that they give you at the hospital." I was like, "Oh no, sweetie," because that's not the flex you thought it was. Because it was saying that if she had answered honestly, they would have put her in the loony bin, and I was like, "Well, sweetie, you should have the truth because even if you did get sent to the loony bin, it could help you instead of you crashing out every other day because you don't know how to process your emotions properly." And I actually see that a lot, that people, because there were a bunch of, it was on Facebook, so you can see the reactions, like the laugh, the hearts, and all that. There were a bunch
Yeah.
of people laughing and not taking it seriously, and I'm like, that's
Yeah.
one I learned not to play around with is mental health because, like I mentioned in my dealing with anxiety as a mom podcast, I literally cut off all my hair because I was having, and yes, I joke about it now and call it my Britney Spears moment because I'm at the point where I can joke about it now. But I I was just dealing with a whole bunch and I just cut my hair off. Like I get why Britney Spears did what she did. It was just a breakdown and I just cut it off. Like I did it before I even realized what I was doing. And by the time I realized, I couldn't put the hair back on my head. So I was
Yeah.
bald for a couple of years. And it all comes down to mental health. If I had taken it more serious or not seriously, if I had taken actual initiative to, kind of heal what was going on with my mental, then I wouldn't have got to that point where I was cutting my hair off. Like, yes, thank goodness it wasn't like me, hurting myself or hurting my child or anything like that. But it can affect you in different ways in your life. It doesn't always mean, oh, you're going to be violent. Oh, you're just going to be super sad and crying every day. It's not always like that. Postpartum depression, postpartum anxiety, postpartum rage, they all come in different forms. Like, I would literally just crash out about the smallest things. I would make it seem like it's just the biggest deal in the world. And my husband's sitting there looking at me
Oh,
like
so
yelling at me.
so now I don't seem so crazy on the days I crashed out, and y'all be looking around like it don't seem so crazy, huh? Now that you have kids.
Crazy. We just thought you were really mean because
Mhm.
because yes, we'll get hollered at from time to time, but like she would take it to a different level and start like digging at you. I was like, oh, that actually hurt my feelings a little bit. And like, yeah, we didn't take it too seriously because we knew she was pregnant. We knew she was tired because she was also working. And if you guys know my mom in real life, how she was when she was pregnant with my youngest sister, she had her sick and tired, literally. So we didn't really take it to heart. It was just like, well, good morning to you too. Sorry. Like, what? Why are you hollering at me? What happened? So I understand it more now as a mom. Yeah. Which, like, like I said, looking back on it, like, I can laugh and, kid around about stuff like that. But at the time, no, I was dead serious and I just wanted to fight all the time. Right. Which I should have, like I said, I should have took that initiative to deal what was going on with me mentally instead of trying to shove it away and continue being worried about everyone else and everything else going on. So, yes, I learned my lesson.
But that's a very important thing. It's not just about taking accountability and taking action. It's about even recognizing that it's going on. And a lot of people don't even recognize. And I know for me, a lot of times I don't realize that I'm in a funk until it's been like a couple of weeks. And I look back like, what is going on? So, that's a big thing. And I think what plays into that is generational silence and shame. Because, growing up, my mom and we didn't talk about sex. We didn't talk about childbirth. We didn't talk about losing a baby. But once I went through some of these things, and she would be like, oh, I remember when that happened to me.
When were you going to tell me?
Right. So, and I think, back in the day, our moms, we didn't talk about birth and we didn't talk about miscarriages and we didn't talk about, not we, but like my mom and the generations before her, it was more of, we're going to keep our business our business. But I feel that, and I mean, that's true to a certain extent, but I feel that at some point we need to have conversations with our daughters about the things we've gone through. I know, dang, what was it Jasmine and I were talking about? I don't even remember what we were talking about, but it was something that I was telling her about. And she was like, me too. And I'm like, see? So, and everybody thinks they're alone when you're going through certain things because you feel ashamed and you feel like you're nervous and you don't want to tell people because it's embarrassing sometimes, but having that, I believe, and which is how I tried to raise my children, I believe transparency is king. I truly, honestly believe that. Like, I feel like my girls, especially, well, the two older girls, they're older girls, I feel like I have done a pretty good job of being transparent with them, especially about things when it comes to relationships, when it comes to sex, when it comes to childbirth. And, like I always would tell my children, you have questions about sex? Come ask me, because I probably had more sex than you and your friends combined. You want to talk about children, childbirth? Come talk to me, because I definitely have more children than you and your friends combined. So that's the thing. It's about, for us as the older generation, it's about being transparent and being open and being welcoming. When it comes to talking about these uncomfortable things, and I don't care about talking about these uncomfortable things, honey. We're gonna talk about it. We're gonna nervous laugh. We're gonna sweat, but we're gonna talk about it because at the end of the day, there's not very much that we go through as women, as Black women, as Black moms. There's not very much that we go through that there's not somebody else who has already been through it or who is going through it now. So I'm a firm believer in transparency, which is a big part of why we started this channel. Because being a mom is hard. Being a Black mom is even harder. Because then you have all these little nuances that you have to navigate them yourselves, and then you have to try to guide your children or educate your children on said scenario, and kind of try to guide them through where they won't have as rough as you. Most of the time they don't listen anyway, but the fact that y'all have had that conversation makes you a safe place to land for them, where, okay, like, I know you told me and I know I didn't listen and I know I screwed up, but help me. And that's what it's about. It's about It's about, growing and learning and doing what it is you need to do, doing what you feel is right for your life, but then also asking for help and saying, hey, look, I'm in a bind, or I screwed up, or this is going on. What do you think I should do? And whether you take that person's advice or not is neither here nor there. But the fact that you have that person there that you can go to and you can ask questions, bounce ideas off of, and then you and your friend, maybe your friend or your mom, your aunt, your cousin, whoever, they can kind of guide you and be like, oh, well, dang, that happened to me, but you would have never known, because often, very often in our culture, we shy away from those difficult conversations. So I try to be the type of mom where my kids come to me and they'll tell me stuff. And what's crazy is, still to this day, there's certain things that my kids will tell me that they think that I'm going to just crash out about. And I don't. And I'll be like, well, what are we doing? So what's next? I mean, because at the end of the day, that's life. And I don't believe in like alienating my children because they did something I don't agree with. Now I will give them the business and they're going to be mad at me for a little bit, but I don't care. Okay. I do not care, because at the end of the day, they know it's rooted in love, and they know that I will always be a soft place to land for them. I'll always have an ear for them. And I feel like just that, then I've been successful as a mom. So that's what we want to do here. We want to be that soft space, and we want to be able to guide our next generation of moms to be able to advocate for themselves, to be able to feel comfortable asking questions, because a lot of times, us as Black women, we don't want to ruffle feathers, so we go along to get along. I will say, I get I get called insubordinate a lot because I ask questions. Like, I want to know, like, what is going on here, but to teach our young women that ask questions, even when people are rolling their eyes at you, or even when people are being like, oh my god, you know ask the questions, because if it's something that you want to know, don't let anyone else deter you, because 9 times out of 10 they don't know either, and they'll benefit from the answer that you get from asking the question that they didn't want you to ask. Haters. So so definitely, the goal is to be that resource or that advocate for our younger generation. So that's our goal for just in general, but definitely when it comes to Black maternal health. Like Shantae said, the numbers are crazy. It's staggering, the difference, the despair, and that's what a disparity is. It's the difference in care, all things being equal, except whatever it is, except it could be race, it could be socioeconomic status, it could be your location, where you live. A lot of stuff depends on where you live, so it's so many different things. And we have such a oh easy such a difficult road to navigate. And from the looks of things, it's going to be a long road, but we're here and we in this fight together. Okay. But if you take nothing else away from this conversation, just take away that get you an advocate. So if you're somebody who's quiet and a little timid in situations, get you a rowdy friend like me, okay? Because one of my best friends she's not timid, but she's very laid back, very quiet. She lets a lot of stuff slide. My other best friend, not so much, but But my best friend who's, I'm the rowdy one. I'll be like, well, wait a minute, hold on. Because, short story. So when I first met my best friend, the one that's quiet, it was on the postpartum unit. She was already working there and I was orienting. And I had a nurse who made me stay. First of all, it pisses me off that as a night shift nurse, I have to do day shift everywhere I go when I first start. That pisses me off to no end. But I'm on my last day shift orientation, and this nurse, she's like, well, I don't like how you wrote your notes. Well, I don't care that you don't like how I write my notes. Is everything that's required in there? Well, yeah, but I would have said it like this. I said, but that's the difference. You would have said it like that because that's you. I meet. So I'm going to say it how I said, as long as everything that needs to be in there is in there, I'm not redoing it. And she was like, oh, well, you're not leaving until you redo it. And at this point, I have been a nurse for like 10 years. So yeah, baby, you got the wrong one. So I was fussing. I was fussing and I showed out. So then the next shift that I worked, she was like, oh, why don't you come sit here? So we started talking and stuff like that. She was like, yeah, when I saw you giving the other nurse the business, I was like, oh, I like her. So then her name is Marquita, but it's spelled phonetically. It's like Marquita. So me, I saw it and I'm like, okay, Marquita. But the Caucasian nurses were calling her Marquita. The Black nurses called her Marquita. The Caucasian nurses and the other nurses called her Marquita. So I'm like, but she never said anything to me. She never corrected me, and she never corrected them. So it annoyed me. And I asked her one day, I was like, hey, Marquita. She was like, it's Marquita. I know, they call me Marquita. The devil is a lie. So if I call her Marquita, I'd be like, it's Marquita. And she would just laugh. But that's the type of energy you need. Somebody who is gonna be there for you no matter what. Because I mean, whether or not it's a big deal to her, it's a big deal. Because that's your name. That's your identifier. Like that is who you are. Everybody gonna be walking around here calling you Marquita. Child, get the hell on. So yeah. So you need you need somebody who's gonna advocate for you. You need somebody who's gonna be transparent with you no matter what. And um that is definitely my goal for my daughters, for my granddaughter. Well, apostrophe S, because maybe I have more grandchildren. I don't know. I do have four kids. So, but yeah, that's definitely the goal. That's definitely the goal. So, yeah, it's just it's crazy. It's a big, big, big conversation to be had, and I feel like we've been yapping all this time, and there's just not enough time. So we're gonna move we're gonna move it. So throughout this week, we're definitely gonna share some resources. And a lot of them probably will be online resources only because I don't know where everybody is. And not every people don't even know for real where I live, like the name of the town, you know what I mean? So it'll definitely be some online resources for different maternal health organizations. Definitely the practice that Shantae used she had for her delivery was it women's care?
Women's care, yes.
Women's care. They're awesome, honey. Dr. Champion and what's the other doctor's name?
Rotundo.
Dr. Rotunda. What if you in the Tampa area?
I love both of them so much. Like if I could have had both of them throughout both of my pregnancies, I loved it. With my
Yeah.
daughter, to a different doctor, but I love to have either one of them because with my first pregnancy, I had the honor of having both of them because
Yeah.
it started off with Dr. Rotundo and then I ended up with Dr. Champion later on because there was, I think maybe Dr. Rotundo had changed the days that she was working or the times of day or something. And at the point where I was doing appointments like it was to the point where I was at every other week and then every week, and that's the point that I had Dr. Champion because that time frame just didn't line up with Dr. Rotundo anymore. But like I said, I love both of them. I would have been great with either one of them. It was just a whole scheduling thing.
They're both awesome doctors. Being somebody who's taking care of their patients, and I know Dr. Champion for sure. I had a patient of hers, and she just needed one thing before she went home. And Dr. Champion gave me her cell phone number and said, "I don't care what time it is. If it's 2 o'clock in the morning and this happens, call me." She gave me her cell phone number, and it happened. And I called her, and she was like, "Boom, okay." I put in a discharge order. She could go in the morning, and that to me, putting yourself in your patient's shoes, understand like feeling where your patient is coming from, finding a provider, a nurse, anybody who operates that way, priceless, priceless. So definitely those two in this area are my favorite. In in Columbus, Georgia, I don't even know if he's still there. The doctor that delivered my middle two, Dr. Malone. Awesome, awesome, awesome. Love it.
There was the doctor that I had with my daughter. She had an extremely long last name. Like, I kid you not, it was like around 20 letters for her last name. So she went by Dr. Sam. Those were the first 3 letters of her last name, but it was like letters after that, but she went by Dr. Sam. I also loved her. I didn't get to, obviously, she didn't get to deliver my child because she was born in the car, but that was the doctor that I had seen for every single appointment that I had with her. I loved her. She was Indian. She wasn't, she wasn't black, but she was Indian, and I loved her no less than Dr. Rotundo and Dr.
But Dr.
Rotundo.
Oh, Hispanic, ain't she? I
Oh,
think Dr. Rondo's Hispanic.
but yes, she is. That accent, thick. I love
Yeah,
her so much. But
yeah.
I love Dr. Sam just as much as I love Dr. Rotundo and Dr. Champion. She just didn't get to, I didn't get to deliver my child with her like the plan, but I still love her the same, no less. And she's also Tampa area. So
So
just want
we'll,
to.
yeah, we'll try to get a listing together. I gotta ask. I gotta ask your grandma again. We'll try to get a list together of some OBs, women's health practitioners that we personally know or that other Black women have gone to and have been comfortable with. And we'll definitely just post them as we get them, and we'll try to compile that list and just have it somewhere. I don't know where, but we'll have it somewhere. So if you have had an experience with a OBGYN where you felt heard, you felt valued, and you feel like you weren't dismissed, definitely let us know what their name is, the name of the practice if you know it, and what city, and then we can add it to our list. Okay? So again, we have yapped quite a bit today, but this is definitely a topic, and all of our topics are near and dear to our heart. But anything that involves the kids is even nearer and dearer. Okay, so if this has moved you in any way, you learned one thing from this, you empathize with anything that we've gone through, or you've gone through the same thing or worse, let us know, and share it with a mom who could use it. Share it with a mom who has insight to give, because like we always say, we want to build a community. So let's get this community popping. Okay, and remember, we deserve joy, we deserve support, and we deserve safe births. Absolutely. Because there's no way that we should be dying at 2.5 times the rate of our counterparts. It's ridiculous. So, you know, let's band together and let's do this. So that is it for us today. Finally, right? That is it for us today. So make sure, what is it, Shantae? Because you're not
Like and subscribe. And we're on Instagram, we're on TikTok, we're on YouTube, Apple, Spotify.
getting, I gotta get us on Facebook.
I will it. You on a Facebook?
Yeah, I'll do a Facebook page.
Up
I'm
there
gonna
on Facebook, but it doesn't transfer over to Instagram, so it doesn't really do me much good.
mm,
Stuff that's just like, like how if you post on Instagram, you could automatically post to Facebook. It'll be don't it'll be posts that I see on Facebook that don't coincide with Instagram.
okay. Yeah.
They're not
Yeah.
like
Oh,
together time.
yeah, because right now if I post to Instagram, it goes to my personal Facebook.
Oh, okay. I've seen that. I've seen like on your story, the stuff,
Mhm.
so the stuff like that. Okay.
Yeah. I'll definitely get us Quibby Chronicles Facebook page. I'm gonna work on it, okay? That's on my to-do list. But until next time, we love y'all. We appreciate y'all so, so much for tuning in and for watching us on YouTube. And, not nobody really listen to us on Spotify, but whatever. As long as you get the message, we don't care where you get it from. So We definitely appreciate you. And until next week, keep growing, keep glowing, and let's take care of each other. Toodle!
Thanks for tuning into the Quimby Chronicles Momcast. Don't forget to subscribe, share this episode, and join us next time as we tackle more of the beautiful chaos that is motherhood.